If you had hip replacement surgery and you want to learn how to get down and up from the floor safely, then this video is for you. My name is Matt Sigua. I'm a doctor of physical therapy, and today I'm going to teach you how to exactly get up and down from the floor safely after having hip surgery. Let's get started. First, after having hip surgery, there are certain movements and positions that we want to avoid or be very careful of when we're moving, especially when you're trying to get down onto the floor and up from the floor. So for reference, I have on a white leg sleeve on my left leg. So this is going to represent my surgical leg throughout this whole video. So my left leg, the one with this white sleeve, this is the surgical side, and you want to pay attention to how I'm moving my hip and my leg on this left leg, okay? We're gonna start with how to get down onto the floor safely. And I'm gonna show you two different ways that I typically teach patients how to get onto the floor safely. The first method of how to get onto the floor safely is gonna be how you can do it while you're sitting down on a chair. So for reference, this bench that I'm using is about 2 feet tall. This also works with a chair that's a bit higher. So step number one is gonna be straightening out the leg that you had surgery on. So for me, it's that left leg that I had surgery on. Now, you wanna make sure that you scoot to the edge of the chair or the bench that you're sitting on to make this movement a little bit easier. We're gonna go both hands onto the chair or bench. Next, you're gonna slide your non-surgical foot underneath your surgical knee, underneath your surgical leg. So this just gets it out the way so that now we're going to slide forward nice and slow. This takes a little bit of upper body strength, not too much. And now you're just gonna go until your shin bone is on the floor. Once you get to this point, you can start releasing your arms, and then you're gonna let gravity do all the work for you. So now I'm sitting on my butt, and if you look at my left leg, my hip is still within that 90-degree precaution, so I'm not overly bent forward and not breaking that precaution. And then from here, you can use your hands if you want to help you straighten out your other leg, but you should be able just to straighten out that leg on your own. And now you're on the floor. And then from here, you can use your hands to help scoot you along to get you onto your back. So that's the first way that I'll typically teach patients how to get onto the floor. So if you have a chair or a bench just like this, then you can go from sitting and slowly sliding your way down onto the floor just like so. Now, a quick detail about the slide method is if you skip the part where you don't put the non-surgical foot underneath the leg, it's gonna look like this. As you're sliding, your non-surgical knee is gonna bend, and then you can get to this point, but it might be a little bit too much stress on that knee. It might be uncomfortable, especially if you're limited at the ankle or knee joint. So then typically you'll have a little bit more pain here. So instead of just keeping your foot there, having that foot slid underneath the other leg, underneath the other knee, that allows you to take some of the stress off the ankle and knee, and then it feels a little bit more comfortable on those joints. And then you can straighten out and get even here. And then another thing on top of that is some people ask, okay, how come I just don't switch here where both legs are completely straight? Now the problem with this method is it's gonna rely a lot on upper body strength, and most people aren't gonna be able to do a movement like this. And then once you get to a certain point, you're gonna put a lot of strain on your chest and on your shoulders, so you don't want that. So that's why you wanna do one leg at a time, right? So again, just for demonstration purposes, straighten out that surgical side. You're gonna slide that foot of your non-surgical leg underneath, and then you're slowly gonna slide till you get your butt underneath. Once you're here, you're gonna straighten out the leg, and then you can do little scoots to get you all the way on the floor. So that's the first method. So for the second method, in terms of how to get down onto the floor, this one's gonna be a little bit more challenging, but I'll show you the way that you can get down without having to start in a sitting position. So at this point, so typically after 6 weeks is when you can start kind of practicing getting down onto the floor. It's not absolutely necessary that you practice this, but if you just prefer to get down onto the floor, then after 6 weeks is typically a safer timeline. So at this point of your recovery, you should be able to perform a mini squat, you know, at least about 45 degrees. So with the doing like a mini squat, what I want you to do is you're gonna have something in front of you, whether that be your walker that you're using for the first few weeks after surgery, or even like a chair or a bench that I talked about before. So what you're gonna do is first, you're gonna get in front of the bench, then you're gonna do a little bit of a mini squat. At this point, you're gonna put both hands on the chair, the walker, or the bench. Now, the non-surgical leg, you're gonna straighten that leg out, and then keeping your posture upright, because I don't want you to bend so far forward and go put too much compression and bend on your hip, on your surgical hip. So you're gonna straighten out this leg, keeping your torso nice and straight and upright. All you're gonna do is bend and bring that right knee down to the floor. And then you made it to the half kneeling position. Okay, so I'm gonna go over that again. So first step, do a little bit of a mini squat, just to the point where you can get your hands onto the chair or walker. Next, you're gonna straighten out your non-surgical leg. So this is gonna go straight. In this position, you're gonna have most of your body weight in your hands and on the surgical side. Now, all you're gonna do is bend your non-surgical leg, so my right leg. You're just gonna sit that knee down towards the floor, okay? Once you're here, you're already in a half kneeling position, and you can easily just slide your surgical foot straight back, and now you're in a full, like, tall kneeling position, right? So at this point, it's gonna be easy for you to do some small steps on the knees, and then you're gonna reach for the ground. And then from here, I like to straighten out that surgical leg just to make sure I don't bend or extend it at the hip too much. And then you can just roll onto your side and then onto your butt. So I'm gonna show that one more time. So you're gonna start in front of the bench, do a little bit of a mini squat, just enough to where you can get your hands onto the chair or walker. You're gonna straighten out the non-surgical leg. You're gonna drop that non-surgical knee, and then you're in half kneeling. Now we just have to get to kneeling. So you're just gonna slide the surgical foot back. Now you're at kneeling. You're gonna reach for the floor. I like to straighten out the leg. You're gonna turn onto your side. Now you're on the floor. So we made it down onto the floor. So we have to get back up. I'm gonna show you from a couple of different angles how to get up safely without breaking those hip precautions. So from this angle, first thing that I'm gonna show you is you're gonna use your surgical leg and you're gonna bend that knee just about 45 degrees, pretty much just to where your feet are flat on the floor. Next, you're gonna bend your non-surgical leg. So for me, it's my right leg. And then I wanna bend it to the point where my right foot, this leg, I want that foot to be underneath my surgical knee. The reason why I'm doing that is because I want to get this knee to be my pivot point. So where I'm going to be able to rotate onto my knees. So our goal when we're in this position where we're sitting on our butt on the floor, we want to get to our knees back to that kneeling position, because that's going to be the best position to help us stand up. So again, you're starting with your legs straight. You're gonna bend your surgical leg, and then you're gonna bend your non-surgical leg, but then place that foot. So for me, it's my right foot, having that underneath my surgical knee, okay? So once I'm there, now you're gonna be using your arms a little bit. So I'm gonna bring my surgical side arm, my left arm, reaching over. And then from here, this is where some of your trunk muscles and a little bit of your hip muscles are gonna be coming into play. So we're gonna go from sitting on our butt, bringing this arm over, and that's gonna help us rotate. And here, you're gonna have enough strength in your non-surgical hip to bring that knee underneath your hip. So now we're in like this quadruped or on all fours. And from here, obviously if you have your walker nearby, you can use that to help you up. But here, typically you'll be able to go up to tall kneeling position, okay? So let me show that again. So you're here, bending your surgical knee, bending your non-surgical knee, having the non-surgical foot underneath that knee. We're gonna reach over and then we're gonna pivot onto that surgical, non-surgical knee. Now we're in all fours, and then here you can either walk your way up using your own legs, or you can use the walker to help you get to tall kneeling. From this position, so you want to have either a chair or the walker nearby, because then that's gonna help you for this next part. So for me, because I'm a little too far away from the bench, I had to show that angle for demonstration purpose, but I can also do a little bit of a small walking here. Now that I'm next to my bench or walker, what we're gonna do next is we're gonna bring up the non-surgical leg. We're gonna lean forward, bring that surgical leg forward, and stand up. All right, I'm gonna show you from this angle now. So again, we're gonna bend the knee of the surgical side. We're gonna bend the non-surgical knee, bring in this foot right underneath of it, and then a little bit of a tip to make it easier for you. The closer this knee is to your surgical knee, it's gonna make the pivot a little bit easier. You can still perform this maneuver with the knee out to the outside of your body, but the closer this knee is to your surgical knee, it's gonna be a little bit easier to pivot. So then from this position, your right hand is gonna be behind you. You're gonna reach over towards the floor. You're gonna turn onto your knees. Now we're in the kneeling position. Use the walker to get to tall kneeling. Now, what we're gonna do next is we're gonna bring up the non-surgical leg. We're gonna lean forward, bring that surgical leg forward, and stand up. So again, we're at tall kneeling position, hands on the walker or chair, bring up the non-surgical leg. You're gonna put weight on that non-surgical leg, push up, and bring the surgical leg forward and all the way up. All right, and that's how you get up from the floor. All right guys, so those are the ways that I teach how to safely and efficiently get up and down from the floor. I always recommend that whenever you try this, that you have a family member or a friend nearby or who's with you. So then if you need a little bit of assistance getting down or up, you have someone there and you're not completely on your own. But if you have any questions about the technique or anything in general related to hip surgery, please leave a comment down below. I do read those and I try to respond to them as fast as I can. And if you found it helpful, please subscribe to the channel and I'll see you in the next video.